I'm Dr. Roadhouse, and I want to introduce you to our patient Jackie. Jackie's in our sciatica relief program. And why don't you just talk about the symptoms, the pain? I mean, talk about the sciatica the way it was before you came in to see us.
Oh, it's probably the most horrible pain ever. It shot all the way down my leg. Probably, honestly, I don't even know when it started.
You've had it a long time.
Good 10, 15 years,
Yeah.
I would say,
Yeah.
and it just progressively got worse. And my husband was a big, oh, you need surgery, and I was dead against that. So I did try the shots. They were gonna do 3. They prescribed me 3, and I did 2. The first one I thought was gonna work, but
Oh, miracle!
yeah,
Ooh,
miracle,
yeah.
and probably not even a week it was back.
Mm-hmm.
So,
but at least you got some relief for that.
Yes.
And that's the first time you had relief in years,
yes,
right? Okay,
yes.
all right.
And so I did one.
So, and these are the shots into the spine,
It
not
was.
not in the muscle or anything, but they actually went into the spine.
It was.
Okay, all right,
It was.
okay.
And so I thought, well, they suggested I do another one, and so I did that.
How far apart were they?
Real close.
Okay,
Really close.
So the first one worked for a week, and then the second one, you know, over time it came back, and so you went to get the second one, and then nothing.
Nothing.
That's a lot to go through.
Yes. So they said you have another one, and I said no, that's too many steroids.
Yeah.
So,
Okay. All right.
yeah.
So you know, I mean, how did it affect you, like, you know, at night, sleeping, during the day when you're walking?
I
mean,
couldn't stand. Walking hurt, sitting hurt. I'd have to pull my knees up in a chair, and
would that give you a little bit of relief?
Would.
Okay.
It would.
But then as soon as you put them down or start
Yes.
walking, sitting.
Yeah.
What about at night? I mean, could you ever find a comfortable position?
Tossed and turned. It was unbearable.
Mm-hmm. So, what did you do, like, as far as just your daily stuff? I mean, how did you get through, and especially when obviously you had to be sleep deprived, because I remember when you came in, you were really tired.
Oh yes. And work, it was really difficult and painful. And just really kind of struggled through it all, and I just had to stand up and sit down and stand up and sit down.
Okay. Right.
Just try to get out of it.
So and then did you try like any pain pills or?
I did. I probably am saying it wrong, but there was a cream that the doctor prescribed.
Mm-hmm.
I didn't.
Well, there's
really
like Vicodin.
That's
yeah,
it.
Okay, right.
Well,
or
something X. Voltex.
Voltaren.
Yes.
Voltaren.
Yes.
Okay, yeah.
He said it was a wonder cream, and
Mm-hmm.
I
didn't know.
No.
Okay. Well, I mean, they tried.
Mm-hmm.
But and so did you try like physical therapy or anything like that?
I didn't. That was going to be my next.
Yeah.
But then I
And then you came in here, and obviously, you're smiling, and you're sitting for a long time here. You're able to sleep, and everything's doing good. So you haven't had this sciatica for a long time, so we fixed it.
Yep.
It's been, I don't even know how long. It's been months that you haven't had the sciatica, and you're doing good. You're back doing things that you want to do. Is there anything, that if you do it now that kind of aggravates it or?
It gets sore and tired, but it's not in my leg anymore.
Yeah, so your back gets sore and tired.
Oh,
you still haven't had anything.
No
to say.
sciatica.
Yeah.
No.
Okay. But you've had that for a long time. So there's still a little bit, and we've working with the exercise helps strengthen that for you. But and overall, it's been a long time, so you can sleep. Everything else is doing good. Yeah. So what does your husband think?
Well, he still says it won't fix it. It won't fix it. It'll be back.
Yeah.
But, so far it's great.
Well, sciatica is one of my specialties. I mean, I found out about chiropractic because I had sciatica myself at 19, and so we do a lot of different treatments on it. We tried a lot of different things with you, and we blended treatments together. And what I did is just tried everything that we know that works on sciatica, and we got really good results. So, because you were not smiling in the beginning. I mean, that's the neat thing about what we do is, patients come in here and they're hurting really bad. You don't get to see their true personality, because they're
I wasn't
hurting.
myself at all.
No, I can tell there's a big difference
Yes.
now, but good. All right. Well, anyway, anything else about any other problems that you had with the sciatica that are gone now? Anything that you can't do? You know, because you guys like to ride motorcycles, right?
Absolutely. Yeah, it was difficult. I could tell my hips were off, and it was just very painful when it was in my sciatica. Yeah, we're good now. And
You can ride and everything.
go.
Good. All right.
Yeah.
Good. All right.
I
Well,
would have done
thanks.
it anyway.
Yeah. Right. Well, I mean, you're gonna feel bad anyway,
Right.
right? When you have it that long for that many 10, 15 years, so you might as well do something you enjoy. Because even if you just sit still, you pay for it. Well,
Exactly.
we're glad that you, first of all, came in and saw us and followed the recommendations and finished the prescribed care, and you're doing great now. And good luck to you in the future.
Thank you
And
very
I'm
much.
glad you came in.
Me too.